evening, good afternoon, good morning, depending on where you are joining us for this program. My name is Julia Rowland, and on behalf of Smith Center for Healing in the Arts, I'm very pleased to welcome you to this second session of our recently launched monthly series, Did You Know? For those of you who may be unfamiliar with Smith Center, we are a community-based nonprofit health, education, and arts organization located in the heart of downtown DC. Our goal is to support the people we work with in taking their next step in healing, whatever that might be. Our work is based on the single profound idea that each of us harbors within us the innate capacity to heal, even in the face of life's most serious challenges. Smith Center promotes healing practices that explore physical, emotional, spiritual, and mental wellness and lead to life-affirming changes. Our programs include cancer retreats, stress reduction and nutrition classes, arts and creativity workshops, healing circles, professionally led support groups, individual patient navigation, young adult cancer survivor programs, a healing arts gallery, and hospital-based artist in residence programs. And because of the pandemic, and an irony, all of those programs, with the exception of our retreats, are actually available online. So we are more accessible than ever, no matter where you are. This year marks the 25th anniversary of Smith Center's founding, and in celebration of that, we are hosting this special series we're calling Did You Know? Each of the talks are going to highlight one of 8 sets of behaviors that research and practice tell us is important to the health and well-being of cancer patient survivors and their loved ones, and fundamentally, all of us, regardless of our cancer history. For each topic, we are inviting individuals who are leaders in their respective fields to talk about what we've learned and to pair each scientific expert with one of our Smith Center staff or another expert colleague engaged in helping people translate the information shared into everyday practice. And today's topic is moving more. Joining us for this are 2 outstanding speakers, Dr. Melinda Irwin from Yale University and Dr. Bernardine Pinto from the University of South Carolina. Both are nationally recognized experts on lifestyle behaviors and physical activity in particular. I couldn't come close to doing either of them credit if I spent the next 90 minutes reviewing their many respective contributions to our understanding of physical activity and cancer. And I hope that instead you have read their impressive bios. And I think that their talks will speak for themselves. Quick housekeeping note again, if you have questions, just drop those into the chat box and we'll try to get to those at the end. So with that, I'm going to turn to our first speaker, Dr. Melinda Irwin, to walk us, maybe run us through the science of moving more and its role in cancer. Melinda.
Okay, great. Let me pull up my, okay, good, great. Okay, so I'm super excited to share with you some of the research that I and others across the country have done in regards to physical activity and cancer prevention and control. If we don't get to any of your questions tonight, feel free to email me and I'm happy to discuss more with you at a later time. So I don't think I have to convince anyone it's the rationale for studying exercise in cancer, but I'll just highlight some important notes. As you might know, there's been a 29% drop in cancer mortality rate since the peak in 1991, as shown here in the figure. And what is unknown, though, is however, will this decline in cancer mortality rates be offset by the rise in sedentary lifestyle as well as obesity? So currently, 40% of adults have a BMI of 30 or greater, which is defined as obesity, and this is a 6-fold increase in rates since the 1970s. And one reason for that is an increase in sedentary behavior because of our iPhones and other technological advances that make us sedentary. And in fact, that increase in obesity has been thought to be associated with a 200-calorie change or deficit per day. So if you do 200 calories less of exercise, that's what has led to an increase in obesity over the years. And also changes in our diet contribute to that. We know that 18% of cancer incidence and 16% of cancer mortality is attributable to excess weight, poor diet, and physical inactivity, and that there are 13 cancers associated with low physical activity levels and 14 with obesity. And then among those who've been diagnosed with cancer, exercise and or lower BMI may favorably impact surgical outcomes, treatment efficacy, treatment side effects, and also disease-free survival. So this is a figure that was published a couple years ago in the Journal of American Medical Association that looked at all-cause mortality. So not just cancer, but we know that cancer and cardiovascular disease are the leading two causes of mortality. And what was really of interest here is these lifestyle behaviors, diet, body mass index, and low physical activity as major contributors to all-cause mortality. So you would hope that with this finding, this would really motivate our clinical community and our third-party payers in reimbursing for such programs that help us to eat healthy, exercise, and maintain a healthy weight. And of note is, unlike many other risk factors, physical activity is modifiable. So this is a good thing because everyone who is inactive can start an exercise program, but it's also very challenging given that active individuals can easily decide to stop because of changes going on in their daily routine. So the goal is to really promote an active lifestyle through childhood and adulthood, making sure there's built environmental changes that promote being physically active, rather than promoting inactivity. And there's, as you might know, there's no single medication treatment that can influence as many organ systems in a positive manner as can physical activity. So what are the current recommendations? And this is based on thousands of studies that are observational studies or interventions or randomized trials looking at the role of physical activity on cancer outcomes. And the first actually is avoid inactivity. And that is because, as I just noted, this increase in sedentary behavior. So just by becoming a little, reducing your sitting time or your inactivity is the first recommendation. And then above and beyond that is 2.5 hours per week of moderate intensity activity or 75 minutes of a vigorous exercise, as well as ideally 2 to 3 times per week of a strength training activity. How do we know it's the 2.5 hours per week or 150 minutes? Because it's based on meta-analyses and systematic reviews of hundreds and thousands of studies that have been done. And we see here that about that 2.5 hours per week, where there's this significant reduction in mortality, and that any additional exercise beyond that is not associated with any more benefit. There isn't an increased risk per se, it's just that few people do very high levels. So it's a little bit of, this finding is not as confident of a finding as in this. So from these findings, it's been about 2.5 hours per week of exercise, of brisk walking or moderate intensity activity that's recommended. So I mentioned on the first slide that there are 13 different cancers associated with physical activity. And this is an analysis done by Steve Moore, who's at the National Cancer Institute, looking at these cancers. And just quickly to show, anything to the left of this bar shows a reduction in cancer risk. And if these lines don't cross it, it's statistically significant. And so you can see some powerful associations between higher levels of physical activity and lower risk of esophageal cancer, gallbladder, liver cancer, lung cancer. Of note, with lung cancer, they stratified this by smoking status, and the association remains. So among smokers, those who were active had a lower risk of developing lung cancer, and then a number of other cancers here. And so that's looking at cancer risk. But then when we look at cancer mortality, so what about physical activity after a diagnosis? So maybe you weren't participating in an exercise program before diagnosis, but became very aware of your physical activity levels after. So increasing your exercise after diagnosis, how did that impact mortality? And these studies looking at breast cancer mortality, colorectal, prostate, other cancers, found overwhelming a consistent finding of a lower risk of cancer mortality among those who are physically active. These are observational findings. So what that means is people will complete a questionnaire, at diagnosis, or 1 or 2 or 3 years after diagnosis, and then they're followed for recurrence or other outcomes. And so they're not interventions, but what's really important to note is that we can statistically adjust for all the other variables that we know are associated with cancer outcomes. So these are adjusted for the treatment that was received, for age, for body mass index, for disease stage, and a number of other factors. And then to even examine that with more detail, you can stratify by disease stage. So you can see that physical activity was associated with a lower risk of say, breast cancer mortality among those diagnosed with stage 3 cancer, for example. So very consistent in findings showing physical activity has a favorable association with these lowering risk and mortality. So how is this possible? What are the mechanisms where physical activity can lower our risk of developing or dying of cancer? There are 3 primary mechanisms that mediate the association. The first is and this example is for breast cancer, but in breast cancer, for example, higher levels of estrogen we know increase the risk of breast cancer as well as mortality, so much so that if a woman is diagnosed with an estrogen receptor positive breast cancer, the standard of care is to take an aromatase inhibitor or tamoxifen. And these endocrine therapies block the production of estrogen either throughout the body for AIs or locally in the breast tissue for tamoxifen. So if we can lower estrogen levels, then we're lowering our risk of breast cancer. And in fact, exercise has been shown in clinical trials to lower estrogen levels over a short period of time, in like 3 months. Second primary mechanism is insulin. We know insulin is a growth factor. It causes cell proliferation of tumor cells. And so if we can lower insulin with exercise, we're lowering our risk of developing or dying of breast cancer. And then lastly is inflammation. We know there's inflammation is strongly associated with developing or dying of cancer. And once again, there are studies showing exercise can lower blood-based markers of inflammation. And then there are a number of other mechanisms, but most of the research focuses on these 3 pathways. So an example is a cross-sectional study from the Women's Health Initiative, which was a large study among 100,000 women, led by Ann McTiernan out of the Fred Hutch in Seattle. Just a simple cross-sectional analysis, but to me very provocative, in looking at these 2 common estrogens, estrone and estradiol, and looking at low BMI but high physical activity versus the other end of the spectrum, higher BMI and low physical activity. And you can just see that those who have a lower BMI and higher physical activity have lower estrogen levels. So that's from a cross-sectional study. But when you do interventions, one of the first trials to show this, one led by Ann McTiernan, was that exercise could lower estrogen levels within 3 months. We did and this is actually the trial that I just spoke about. So, and this was a year-long exercise trial led by Ann McTiernan, where it was brisk walking on a treadmill or outside, that 2.5 hours per week of exercise. And even though it was a year-long trial, we measured blood also at 3 months. And you can see these are the percent changes in the women randomized to exercise. About a 4%, 8%, and and about an 8% decrease over a short period of time. So very clinically meaningful findings of the role of exercise on lowering a strong marker related to breast cancer. Ann McTiernan and her colleagues followed that exercise trial up with a combined 4-arm trial of a diet-induced weight loss versus exercise versus the combination. So this was a 4-arm randomized trial where women, there were over 400 women. These were women without breast cancer, but at higher risk for breast cancer. They were enrolled and randomized to one of these groups. So at baseline, they were not eating a healthy diet, nor were they exercising. And so improving their diet or adding in the exercise or the combination, look at the impact it had on these biomarkers measured in the blood that we know are strongly related to various cancers. So I mentioned insulin. So this was also a year-long trial, but look at the reduction in insulin levels by changing diet or exercise or the combination. And then the estradiols, and then C-reactive protein is a marker of inflammation. Look at these reductions. So really clinically meaningful reductions. So some might say, well, exercise seems to have a lower reduction in these markers than diet or even the combination. And that might be true because one of the mechanistic pathways is weight loss. And we know exercise is primarily associated with maintaining weight loss after, say, diet-induced weight loss, and also prevention of weight gain. And what I tell a lot of the participants in my study is the goal really should be, as we age, is to prevent weight gain, because unfortunately, as we age, we lose muscle mass and we lose bone mass. And this can change our metabolic rate, and so naturally, we might gain 1 to 2 pounds, if not more, as with each year that we age. So if we can just prevent that weight gain with exercise, we can significantly impact our risk for not only cancer, but other diseases such as heart disease and diabetes. So this trial was in women without breast cancer. And I was fortunate to train with Ann McTiernan out at the Hutch. And when I came to Yale, I was interested in looking among women with breast cancer. Once again, maybe they were inactive for a year or 5 years or decades before their diagnosis. And would exercising after diagnosis improve certain markers related to recurrence and mortality? So we did a year-long exercise intervention in women with breast cancer, and there was no intervention with diet. This was exercise alone. And we saw about a 2.5% decrease in body fat. This was measured objectively with DEXA scans. So it's the gold standard way of measuring body composition, body fat, and a modest increase in lean mass and a maintenance of bone mineral density. So these were women on average age of 60 years old. And as I just mentioned, the goal being prevention of weight gain. So over this year-long study, you could see favorable changes, or at least a maintenance of these important body composition markers. And this translated into a favorable reduction in insulin levels of about 7% and some other growth factors we know related to breast cancer. So of note, though, is many people will say, okay, that's all really interesting, but what about the effect of exercise on tumor growth? There have been animal studies that in mouse model studies that have shown that exercise can slow tumor growth, and that's really exciting. But it's harder to study in patients, especially with a cancer such as breast cancer, where at diagnosis, you want to, within a month, remove the tumor. And other cancers where maybe like prostate cancer, where there's maybe a watch and wait period of 6 months or so, you could intervene with exercise and measure tumor markers. But we were intrigued in looking at the role of just 1 month of exercise on reducing, favorably changing markers in the tumor tissue. So what we did is a study that we called the PREHAB study, and this was in collaboration with Dana-Farber Cancer Institute with the co-PI Jen Ligabell out of there. It was a small trial of only 50 women who were just newly diagnosed with breast cancer. And as those who've been diagnosed with cancer know, you have a biopsy, and when those results come back, there's if unfortunately you have breast cancer, there's about a month period before surgery. So what we did is we randomized women to an exercise intervention or a mind-body intervention over 4 weeks, where they did 5 days a week of about 30 to 45 minutes of exercise, and then they had surgery. So we were able to look at tumor tissue markers from the biopsy and then at surgery. And what we found was we also collected blood. And what we found is, remember, this was just a 4-week period. So the challenge is we didn't have a long time to really look at longer duration of exercise, but we did see a decrease in leptin. And leptin, we know, is a marker also related to cancer risk and mortality. So a significant reduction here in leptin levels and a slight increase in the control group. No other changes in the other biomarkers, probably because of the short duration, but they were all in the hypothesized direction. And what we found for the tumor markers, I know this slide probably doesn't make any sense to you, but we did this sort of gene analysis where we look at various genes in the tumor tissue. And these are 18 inflammatory pathways that were favorably reduced with exercise compared to the control group. And these were significant, these 18 pathways. So our takeaway from this study is that inflammation seemed to be a major mechanism in how exercise can slow tumor growth with these favorable changes in the inflammation pathway. So those are preliminary findings because it was a small sample size of 50 women, but very exciting nonetheless, we thought. So I mentioned earlier from Ann McTiernan's studies that it seems that the combination of exercise and weight loss might be more favorable. And so we've completed a trial called the LEAN study in women with breast cancer with exercise and diet-induced weight loss. And just before the call, I was mentioning to Julia Rowland how we have a trial open where it's telephone-based or in person, it's during chemo, but we didn't have to stop because we had previously tested in this trial where we compared our 11-session counseling program, that doing it telephone versus in person, and found a similar amount of weight loss, about a 6% weight loss over 6 months with the counseling done over the phone versus in person. So that allows us to now know that using the telephone or Zoom to do interventions is as effective as in person. And in fact, it translates to, in this study, a 30% decrease in C-reactive protein levels. So a 6% weight loss leading to a 30% decrease in a marker of inflammation. So we were really excited with that finding as well. So one of the major organizations that really looks at the importance of exercise with a number of health and disease outcomes is the American College of Sports Medicine. And about every 10 years, they will review all the literature to look at, what are we seeing? And so just last year, a group led by Katie Schmitz out of Penn State reviewed all the literature related to exercise and cancer outcomes. And this slide looks at treatment side effects. And there was strong evidence for exercise reducing some of our quality of life measures: anxiety, depression, fatigue, quality of life in general, physical function, and lymphedema. Moderate evidence, meaning there's just fewer studies done, not that it's maybe a weaker association, but informing the scientists that we really need to do more research looking at how exercise may improve sleep, because we know sleep can be a major factor for a number of health outcomes. And then also bone health. And then also insufficient evidence related to cardiotoxicity, neuropathy, cognitive function, falls, nausea, pain, sexual function, and treatment tolerance. So there's a nice thing about these papers that come out and say what needs to be done is the NCI and other foundations will then look to support studies that focus, say, on cognitive function or neuropathy or cardiotoxicity. So there's a number of studies in progress right now looking at these outcomes. So I encourage the Smith Center maybe next year or in 2 years to reach out to some of these investigators to share their findings, because I know that these are important endpoints or treatment-related side effects that impact a number of patients. Because one of the endpoints here was pain, and you could say, how do you define pain? We looked at that in regards to joint pain. And so we completed a trial looking at joint pain associated with aromatase inhibitors. As I mentioned, AIs are commonly prescribed for women who have estrogen receptor positive breast cancer. And these medications, which are taken orally, are really effective. Some might say even more effective than chemotherapy, yet they have side effects such as joint pain. So we did a trial of exercise on improving the arthralgia or the joint pain. And some might say, if you're having joint pain, why do you want to exercise? And so what we did is we took a group of 121 women with breast cancer who were taking an aromatase inhibitor and at baseline reported having joint pain due to the medication. And we randomized them to exercise or usual care. And in fact, the exercise group was able to, and they were all inactive before enrollment. We were able to get them up to doing that 150 minutes per week, the recommended amount. We had an in-person strength training session and they had 70% attendance, and a clinically meaningful change in your cardiorespiratory fitness measured from VO2 max, and then a modest change in body weight. And then that led to about a 30% decrease in pain, worst pain, pain severity, and pain interference associated with the medication. And so this is we measured this with a questionnaire called the Brief Pain Inventory, which is a very commonly well-validated and reliable questionnaire. It's a 10-point scale. And so we saw changes in the favorable direction. So at baseline, women reported moderate joint pain. We saw a 30% decrease, which brought them to mild pain levels. And our intervention has been shown to be more effective than some of these other treatments for joint pain. So an important finding. So I'm going to just touch upon another area of interest right now, and NCI is likely to have an RFA out on this later this year, so I hear, and that is looking at chemotherapy completion rate or adherence to chemo. This was an observational study that was among a number of different cancer types, so breast, lung cancer, colorectal, and I know this is small and you can't see it, but this is just showing the adherence to the chemotherapy regimen. Some might think, isn't it 100%? If you're prescribed chemo, you would hope the adherence is 100%, but in fact, it's not. And when they stratified by body surface area as sort of a measure of body mass index, those with a higher body surface area, 42% did not adhere to the chemotherapy regimen compared to 25%. So these observational findings were intriguing to us. And what we did is a chart review among women treated at Yale, at our Smilow Cancer Hospital at Yale. And we did an epic chart review of over 240 women. And we found that 37 of patients had a dose delay in their chemo, or 37% had a dose reduction. So combining those, about half did not adhere to the chemo regimen. And this was also recently shown in a study out of MD Anderson. And what we looked at was BMI and physical activity. Just looking at the exercise, those who were had a higher level exercise were more likely to complete their chemotherapy than non-exercisers. So observational findings, but intriguing, which has led us to a current trial that we have in progress funded by the NCI, where we are recruiting women who have just been diagnosed with breast cancer and will initiate chemotherapy to a year-long exercise and nutrition intervention or referral to our 2-session survivorship clinic to look at the primary endpoint of chemotherapy completion rate, as well as these other endpoints. And what we really hope is that if we show that our intervention is effective, then this will become standard of care, that when diagnosed with a cancer and you see the medical oncologist and the surgeon or the radiation oncologist, you also see your physical therapist or your exercise trainer, as well as the registered dietitian, that this becomes just a part of the standard of care and it's reimbursed through insurance, and that we have programs available at the clinic and in the community to help you maintain or improve these lifestyle behaviors. In the interest of time, I'm not going to go through the intervention, but happy to answer any questions relate to it. And specifically with our physical activity, it's the recommended amount of exercise. We developed a home-based program where we have videos and we send weights and a Fitbit to the participants at home. And a number of comments from the women that have participated so far. We have had about 152 have gone through the trial so far. Saying it's quite feasible to do this intervention during chemotherapy, and it's been associated with, really changing their outlook and how to the importance of exercise and healthy eating. In the interest of time, I'm just going to go ahead and show one last slide here that a lot of people will say, okay, But what about a randomized trial of exercise on actually the endpoint of recurrence and mortality? Because we can look at surrogate markers or observational studies. Well, such a trial is in progress. It's exercise and diet-induced weight loss. And this is among over 3,000 women with breast cancer out of Dana-Farber, led by Jen Ligabell. And this will be a definitive trial showing the role of this lifestyle behavior on breast cancer recurrence and mortality. And hopefully the findings will be favorable, and that will really cause a seismic shift in reimbursement and our standard of care, as mentioned, including these behaviors. Another really important area right now, if you've heard or read in the literature, is sarcopenia, which is muscle loss that is either because of chemotherapy or aging related. And important to show that it's exercise that can help maintain muscle mass and muscle function. And it's thought that sarcopenia is more strongly related to cancer mortality than many other factors. So I think going forward, there's going to be a lot of research really looking at the role of exercise on sarcopenia and then on cancer outcomes. So I'm going to leave how we get patients to exercise to Dr. Pinto and her talk, because of course, as the evidence accumulates to showing the benefit of exercise, it's really dependent on then the providers in the community and the clinic making those resources available. So I'll just go to my last slide here, which is a little bit of the gaps in our in the research, which I kind of touched upon. A lot still that we want to do to sort of make it personalized, but at the same time, we know that the recommendation is just to move more. So not sure how personalized we need to get with the exercise interventions, but important to look at how it might impact different clinically relevant endpoints. So my last slide here, as I mentioned, my goal that I would like to see over the next year or so is really embedding these lifestyle behaviors as a part of standard of care after a diagnosis of cancer. And I'm incredibly thankful to all my colleagues and research teammates at Yale and the funding as well for me to do these studies. So with that, I'm happy to take any questions now or via email at another time. Well, shall I stop sharing?
Yes, please. If you stop sharing, then Dr. Pinto can load her files. I'm going to hold off on answering questions till the end, so I'll let Dr. Pinto speak first. What an incredible, fast-paced, yes, as I expected, action-packed talk, Dr. Irwin. And as you said, now for the real challenge is how are we supposed to act on or translate into action the rich information you just shared, which is going to be the daunting task for Dr. Pinto, whom I'm going to point out. I don't know if you saw her in her clip. When we were getting together before we launched this evening's program, I noticed Dr. Pinto's background showed park benches. And we often talk about science as trying to take work from the lab bench to the park bench. And it's such a great metaphor for Dr. Pinto's comments now, her sharing her wisdom now is how do we then translate this into practice? So Dr. Pinto, the floor is yours. And you're on mute.
Thank you, Julia, and good evening to everyone. Melinda has done a wonderful job of outlining all the research evidence that supports the benefits that exercise would have for cancer survivors. But the challenge is how do you get people to make those changes? As we have found during this COVID pandemic, making behavior changes is perhaps one of the toughest things that can be asked of individuals, not only to make the changes, but to sustain them. And to some extent, physical activity is not a whole lot different. Just to let you all know, I'm a clinical psychologist by training, and I've spent almost all of my career trying to get patient populations, middle-aged, older adults to become and stay physically active. And a particular area of interest was to work with cancer survivors. And I have developed and tested various interventions, mostly home-based. I try to reach patients where they are. And I was also a part of the group that put together the first guidelines for exercise survivors in this country that Melinda referred to. This was in 2010, and also participated in the panel that put forth the updated recommendations in 2019. So let me get started and kind of outline what I was going to talk to you all about today and share with you all very briefly some of the takeaways from science and the evidence, but spend most of my time talking about how do we motivate people to become and stay active. And I also want to spread beyond the individual survivor to the larger context, how other people can help in this endeavor. So as has been pointed out in the earlier presentation, how much activity are we talking about? Well, at least we're talking about 150 to 300 minutes of moderate intensity activity, and strength training about 2 to 3 times a week. However, I wouldn't want anybody to look at the 150 or 300 minutes and say, well, I'm never going to be able to get there. What we want people to understand is smaller amounts of activity is beneficial. You want to start somewhere and build it up. But bottom line that I would love for you all to take away and to share with others is keep in mind that some activity is always better than nothing at all. So from the literature itself, we have some key points. We know that's really important for people to avoid inactivity. So it doesn't matter which particular cancer you've had, try to avoid inactivity. We've also shown through the many studies, and there are more than 100 now of exercise trials that have clearly shown that exercise can be safe for patients both during treatment as well as after most treatments. But the level of supervision that a patient may need might vary. But bottom line is that all of the data, and there were some excellent graphs of meta-analyses that Melinda shared, the risk-benefit ratio is in favor of people becoming active, even if they weren't active before their diagnosis. And a few other elements from the literature, we know that it is very important to tailor what we're trying to do to where the patients are. So the disease type that they have, is it a cancer of the breast? Is it lung? What stage of cancer? What type of treatment did they have? Patients who have had chemotherapy, etc., tend to have more severe side effects. How long has it been since their diagnosis? Their weight, and even genetic factors. We also know that the message that we want to send patients will be different depending on whether they were active before treatment or they've never been active. And we've also learned that when we are trying to develop these interventions, we want to get people to understand how it is relevant to them. So for some people, the important element is reduction of pain. For others, it might be fatigue. So we want to focus in on on effects that are meaningful for the patient, and that will focus on symptom management and to a large extent on independence. People want to carry on their lives more or less independent. It's a very important cultural value here in the US. So we know that that is what patients actually want. So when we think about motivating cancer survivors, there's some literature to suggest that at diagnosis, during treatment, and afterwards, people are more receptive to these messages to change their lifestyle. So we call those teachable moments, but they're not really moments. I like to think of them as phases, that people become more receptive to these messages, sometimes right at the end of treatment, but sometimes it can also surface when you go in for your follow-up appointments. And when people are more receptive, healthcare providers can talk to them about these behaviors. And the other, of course, is the large database that we've gathered, which is captured also in the excellent review that was published after the American College of Sports Medicine's panel met, and the new recommendations that are captured in the ACSM recommendations. So let's think about, okay, we know that we're supposed to be active, there's evidence piling up, but why don't people become active? Well, they encounter a lot of barriers. Some of them are real and some of them are perceived, and much depends upon how often those barriers occur and how strong they are. So right now, I mean, I live in South Carolina. So right now, we are not dealing with any snow and ice. On the other hand, for those of you all in the Northeast, well, even in Texas right now, if you're dealing with snow and ice, that's a barrier, and in some cases, which may last for several months. So that's a significant barrier, which is not true of the southern states. Mostly cancer is a disease of the aging. So patients are encountering just the changes that occur with aging, a reduction in functional capacity, in your fitness, in your muscle strength. And then there's a slew of treatment effects. Some of them occur during treatment, some of them occur afterwards. There's the problems of lymphedema, there are problems of neuropathy, and that varies depending on where they are in treatment or post-treatment. And then, of course, people have their own anxieties and fears. What is this going to do to my treatment? What is this going to do to my fatigue? And even before they were diagnosed, they have their own attitudes and beliefs about exercise. A lot of people, when they use the word exercise, they are thinking of the time when they were in high school. And, you know, I can't do that anymore. I can't play those sports anymore. So they identify with that and therefore think that they can't do it. And then cancer survivors, just like everybody else, face the usual barriers of lack of time. I can't get to a gym. The weather's poor. So those barriers we all face. So let me stop for a minute. I want to share with you, I tend to run programs where I offer peer mentoring from breast cancer survivors to other breast cancer survivors. So I want to share this brief video from DA. She's one of my coaches. Actually, she is in Rhode Island because that's where I used to be for many, many years. And she's still continuing to help in my studies and mentor other people to be physically active. So I want to just share with you what she has to say.
Bernie, we can't hear her.
Oh.
Now we've lost your screen.
Is that better?
Yes. Make her, if you can pump up her volume, that'd be great.
First of all, I could very, very easily become a couch potato because I love to.
Oh, I'm very sorry. Hang on.
Okay. Okay.
Some of the barriers that I have overcome in striving to become physically active. First of all, I could very, very easily become a couch potato because I love to watch programs on TV like the cooking shows and HGTV. And so I've set a rule for my house. No TV before 5 o'clock in the afternoon. And that has definitely helped me not get waylaid by even the morning shows on TV. So no TV till 5 o'clock in the afternoon. I highly recommend that. It gives you much more time to get out there and do your walking or whatever exercise you like to do. Much more accomplished. Number two, when I first started walking, I will be honest with you and say that I did look for excuses not to do my walk. But once I got into the routine, and it takes a little while, but if you build up slowly and you get into a routine, you actually end up looking forward to it. You do feel better when you get out there and walk 10 minutes a day and then increase it to 15 and then 20 and so forth. And I think the Surgeon General wants us to walk 30 minutes or some kind of exercise, 30 minutes, 5 times a week. And you can reach that goal attainable. I make goals for myself, and I really feel good on the days when I reach these goals and exceed those goals. It's important enough for me to think of it as a doctor's appointment. I wouldn't miss a doctor's appointment, so I don't want to miss my getting out there to get my exercise in. Working around the weather can be a challenge, and there are times when it is definitely a barrier. But on those days that are too steamy to walk, or too icy, or too snowy, or too rainy, I turn on YouTube. And if you type in walk at home, any number of exercise routines come up, and you can walk the equivalent of 1, 2, or 3 miles right in your family room or wherever your TV is. So you have no excuse not to get out there, even on the bad weather days. You can also go to a big box store, walk around the store, go to the mall and walk. These are all ways to keep your commitment to being physically active, even when the weather doesn't cooperate. Going with a friend is also a good way to keep me on the straight and narrow, because I don't like to let my friends down. And having a commitment to walk with a friend is going to help you to stay on that path. Besides, you have good conversation when you're walking with a friend, and it makes the walk go very, very fast. And if you're traveling, you have no excuse not to walk. If you're in a plain old motel, walk up and down the hallway. If you're in one of those fancy hotels, use the gym. But just don't not walk. Get out there and be active. You'll feel so much better when you do.
So I think Dee has done a great job of talking about many barriers and how she has overcome them. And as you can tell, even though she's been active for a long time, it's still a struggle for her. So, you want to consider what your own attitudes and beliefs are about exercise. And I think one of the key takeaway messages is that you want to find an activity that you enjoy. And you want to focus on the benefits that are meaningful for you. So for some older patients that I work with, what's important for them is they want to keep up with their kids, or they want to be able to carry their groceries. So you want to focus on the benefits that really are relevant to you, not to your neighbor, but to yourself. And one of the other elements that we often forget about, but DA mentioned, is one, go out and walk, you're going to feel better. Your mood improves because physical activity tends to release the feel-good hormones. So it helps to manage anxiety and depression. And especially over this last year of the pandemic, we know that stress levels among people have been so much higher. So even if, using a climbing wall is what you enjoy, then, and you're able to do that, then that's an activity that you should incorporate into your lifestyle. But remember that you yourself are in the driver's seat. You've got strengths, you've got the social support system, you've made other changes in your life, you've gone through cancer treatments. So that indicates that you yourself have a considerable degree of resilience. But you want to explore what kinds of activities would appeal to you. Do you want to do things by yourself? Do you want to do it in a group? Are you fine with a virtual community, which many of us had to do during this pandemic? But ultimately, you are the one who can decide when, where, and how you will exercise. And there are a whole plethora of programs, all the way from cancer rehab, which is usually in hospitals, all the way to community-based programs and distance-based programs. I also want to mention that for some people, there are activities that are very specific to their cultures. So worship dance, for example, or in Europe, prostate cancer patients are taking part in football, because as young men, that's what they used to do. So activities that may be very specific to certain cultures appeal to people who belong to those groups, and therefore they're more to join and keep it going. Now, there are, I want to touch base on in different groups, and I'm sure by doing that, every one of you will know which particular group you belong to. So there are some people who are not motivated to change and become active. Perhaps they don't know, or they have rejected the evidence that Melinda described about exercise and its benefits. it could be that they do know the benefits, but like many of us, they are faced with a lot of different priorities. They're dealing with work, they're dealing with family, but at the same time, some patients during treatment, they reappraise what their priorities in life are. And sometimes lifestyle changes can surface to the top 5 perhaps on their list. So if you're in that group, what I would suggest is you want to focus on what you gain from physical activity, not what you're losing, but what you gain. Whether if you're exercising outdoors, you're out in nature, or is it that you're exercising with someone else and it's just a nice social activity. But you are in the driver's seat, so you have choice and you have autonomy. The other a very important element, especially for women, is people require social support. Many people do, but it could be in the form of just learning from other people whom you identify with as to how they became active, how are they staying active despite all the different barriers we talked about. So they could be your good friends, they can be other survivors, or it could be people that you follow on social media. Then we have people who do indeed want to change, and they're motivated, but they haven't done anything. Some of that might be because they're confused. They don't really know what I'm supposed to do. Is it safe? Where can I do this? In some cases, they want to change, but they may be experiencing pain or neuropathy. And then there are the logistic barriers, the problems of getting to a gym, the costs involved, even utilizing online programs, as I just demonstrated, unfortunately, people may lack the technical skills to access the programs. What I would suggest is that, especially if you're confused about what to do, it's really important to get guidance from your healthcare provider or your nurse, or someone that you're seeing regularly, because they would know what you are capable of doing with and your symptoms. And if you do have side effects and you have neuropathy or pain, it's really important to avoid unrealistic goals and then get help to take care of those side effects that you're experiencing. And for others, it may just be that they are able to function fairly well utilizing digital interventions. So then we have, and I'm sure there are some of you all in the audience, the people who have motivated and you have changed. So you've understood what the benefits are of becoming active. You've overcome the barriers, and maybe you still struggle with them, but you're still working on overcoming those barriers. You've made it a lifestyle change in adopting physical activity. So it's not something you do once in a great while, but it's a part of your routine because you've made it a priority and you're somehow able to manage your time. It's not like you've got more time, but you're using your time more wisely. To keep motivated, you would need some feedback from your healthcare provider or from little activity trackers that give you the input that you're on the right track and things are moving in the right direction. So sometimes patients are so thrilled when their physician tells them, we can reduce your dose of blood pressure medication because you've been exercising. So those are really important feedback indicators to people to help them to stay motivated. And the other would also always be set new goals for yourself so that you're not in a rut. So when we work with cancer survivors, what we know that we really have to focus on is we have to individualize. Just as I'm sure in the audience here today, there are some of you who used to exercise before your diagnosis. Your important goal would be maintaining. Some of you may be able to become active on your own, but others might need referrals from your healthcare providers. If you are one of those people who has been sedentary all along, start with low intensity activity and then build up to the 150 minutes and eventually perhaps to the 300 minutes. So let's divvy people up again. So if you're not currently active and you want to start, first is you want to check with your healthcare provider if it's okay for you to begin a program of activity and ensure that you are exercising safely. And here are a couple of questions that you can ask. Do you need physical therapy before you can start exercising? Do you need to exercise in an on-site supervised program, or can you exercise outside of it in the community like the Live Strong program or Silver Sneakers? Are you able to exercise even by a phone delivered intervention or web-based programs? because you are able to physically function well enough to do that. If you're using online programs, and DA mentioned this, just make sure that when you run your search that you select programs that are appropriate for your functioning. So I remember once I put in something about strength training and I got some advice of doing push-ups. I have lymphedema. Push-ups are not the best for me. So you want to be careful about that. And also think about the costs involved. Silver Sneakers is a program that's free for people with Medicare Advantage and Medicare Supplement, but it's not always free for everyone. So once you have decided you want to become active, set yourself very small, achievable goals. So it could simply be, I want to achieve 3,000 steps per day. So make this a goal that's small, that's achievable, because then you're going to be successful. Select activities, like I've mentioned before, that you might enjoy. Dance is something that many people don't think of as exercise, but it is. So any type of activity, Zumba, shooting hoops, if you're up to it, you can follow those kinds of activities. And if it requires equipment, you need to make sure that you have what you need. So, for example, if you want to go biking and you've not checked whether your bike is even functioning, that may not be the best. However, you can get yourself started. So get your equipment ready, and then the next day you can start your program. For those of y'all who are exercising indoors, it's really helpful for many people to use some type of distraction, whether it be television or listening to audiobooks or podcasts, and the time just seems to fly by. DA mentioned working with a buddy and that could be in person or virtually or with a team, because for many people, they need that other person to make them more accountable. Track your progress. There's nothing but like seeing those steps increase. Right now, I'm taking part in a pedometer challenge because at work, and it's nice to see that growth of steps from week to week. And then always think about what reward can you offer yourself for achieving your goal. If you've got to 3,000 steps a day, what might you enjoy? And hopefully try to stay away from high sugar products, maybe some flowers or things or movie that you might enjoy. So think about rewarding yourself to keep yourself on track and motivated. A couple of other questions I want to just share with you all. When you work with a trainer or therapist, find out about their specialized training. Are they lymphedema? Is the person a lymphedema certified physical therapist? Does the person have American College of Sports Medicine certification? Find out whether they have had experience working with cancer patients, and especially patients like you with your specific disease. And also ask, how would you know, and how is the other person, the trainer, going to know that you're making progress? So these are some of the questions if you're working with a trainer or a therapist. So let's move to the second group of people. You are active, but you're not active as regularly as you should be. Mostly this happens, from my experience, when people just forget to exercise. They need some cue or some prompt, which you can do nowadays using your smartphone or your wearable device. Things can beep at you so that you're reminded that it's time to get up and take your walk. What I always suggest to people is find ways to add activity in your life, but not try to find more time, because we are all unfortunately restricted to 24 hours a day. So think of ways where you can be smart about exercising. So for example, if you're watching television, walk in place during commercials. When I talk on the phone, I'm constantly walking up and down. And that's how I can rack up a lot more steps when I'm because I've had long phone conversations. Reach out to your friends and your peers for social support, just so that you can have that extra little reminder. And also find a time that works for you in terms of exercising. For some people, it's the beginning of the day, and then they're done and they don't have to think about it again. Mostly I've worked with people who often forget to exercise because they say, oh, I'm going to do it later, and I'm going to do it later, and later never comes. So that's why exercising at the beginning of your day works well for most people, but not for everyone. Now, on the other hand, a few of you all in the audience, you might be already super trailblazers and you are already active. For you, my advice is find a way to change your routine, shake things up occasionally, set a new goal for yourself. earn new badges, on many of the virtual programs, or join a charity event, raise some funds. Or I have had some people who have set up their own walking teams. And then they compete with other people.
Did you ask me?
And then they love competing. Some people are born competitors, and they love competing with family and friends, and that has really helped, I think, many people during the pandemic. So they compete, but don't actually meet each other. One of the other elements, apart from leisure time activities, I want to highlight that it's so important for us to thread activity during our day. And I know there's an element of irony in this, because we've all been sitting for at least an hour, but it is so important to break up sitting, whether it be doing your chores during the day, or walking to the mailbox, or walking the dog if you have one, because we have very strong data that shows that prolonged sitting can increase your risk for certain types of cancer. So that's particularly true during this pandemic, when many of us are participating in many different Zoom meetings, and we're sitting and sitting. So we've got to find ways to incorporate activity. So I don't usually have a water bottle at my desk, so that I'm forced to go downstairs to get a drink of water when I need one. Strength training is something that you can do quite easily at home. You can use dumbbells, you can use elastic bands, or use your own body weight, as long as that is safe for you. If you have lymphedema, that's important for you to wear your compression sleeves. So these are activities that you can do within your home environment quite conveniently. And as I wind down, I do want to mention, don't forget other activities of everyday life that all of us have to do, all the various chores. Those are activities where the body moves. So that does count as exercise, especially if you do it with a bit of zest and vim to it. So doing the shopping, doing the ironing, cleaning the house, these are also activities, though perhaps we all don't smile blissfully while we're doing them, but they do count as forms of activity. Social support, I think at this time of pandemic, has become so challenging for people. And because you cannot meet anyone doesn't necessarily mean that you have to be isolated. We have seen a tremendous uptick in people using wearable devices to track their activity. There are numerous classes being live streamed because going to the gym is not as safe as it used to be. And I would encourage you all to share your progress, whether you on WhatsApp or whatever social media, because the support and the kudos you get from others can get you through a slump in your activity. And of course, if you have a trainer, stay in touch with the trainer, because they are offering many classes virtually as well. So as I want to step back now and move away from the individual survivor, but think of the larger context in which survivors are members of families, they're members of a community, they're members of a healthcare system. So I've talked quite a bit about the patient and how to motivate the patient, but there's the family and the peer support, the healthcare providers, the local environment. This includes your parks and recreation, and national and state health policy. But I'm going to just talk about family and healthcare providers for a few minutes. So if you are a family member of a cancer survivor, or a friend, you want to understand how physical activity can help that individual improve their functioning, improve their quality of life, reduce fatigue. Now, you might be concerned about, I don't think this is a good idea for them. So when you go with them to their healthcare provider, you can ask these questions. If my sister or my brother starts strength training, what might that do to their bone health? You can ask those questions. Be willing to support them. And here you want to find out what type of support they need. Is it that they would just like you to just call them once in a while to check in, or do they want you to exercise with them? What type of support? In a small study that one of my students did, we found that women with breast cancer, their children would remind them to exercise or check in with them, but they were actually exercising with their friends, which made sense because these children were all adults and were no longer living in the home. So that's how they supported their mother by checking in with her. And the other very important element is advocacy for services. I think the louder the families speak and ask for services, then healthcare systems are more likely to provide them. And this includes physical activity and programs that would support having a physically active lifestyle. I would be amiss if I didn't talk about the healthcare system. And unfortunately, our observations have been that there are multiple missed opportunities in the healthcare system because promoting exercise is not an established part of cancer treatment or of follow-up. And you want to think about your own provider. Do they ask you or advise you or arrange for follow-up regarding exercise? Unfortunately, many don't. Part of it is that they don't have that knowledge or the expertise. But there are plenty of resources out there where your own providers can access information. The American Society of Clinical Oncology has a toolkit. There are guidelines that the National Comprehensive Cancer Centers have. There is an exercise in medicine initiative that was sponsored by the American College of Sports Medicine. And these are for healthcare providers so they can go in there and get information. And of course, the American College of Sports Medicine website. The reality is talking about exercise in the context of a healthcare visit is not reimbursed. And that is why, for a large extent, it has not become a priority. So that's where it's important for patients as well as their family members to speak up. Ask your provider how physical activity might help you or your loved one in recovery. Ask for referrals. If you need physical therapy or you need other types of specialty care, ask for it. But be aware that there may be some co-pays. And I also encourage my patients, tell your healthcare provider that you're active, because that will help them understand how you have benefited, and maybe then they will talk to other patients about being physically active. So this is what you can do if your family member has had cancer, or a friend or a peer. These are the ways in which you can support them and motivate them as well. I'll wind down at this point and open it up for questions. I've also provided email address if you have any questions that you want to email to me. So thank you all for your attention.
Terrific presentation.
And I'll stop. I'll stop.
Terrific presentation, Dr. Pinto and Dr. Irwin. I'm sitting here thinking of all the points that you've raised for us. A couple of the questions that came up, and I know that Melinda, you started to answer one. There were a couple of questions about the interplay between exercise and meditation. And I know you've done some of this in your studies. You want to make more comment on that?
Yeah, I think this is a really important area that has been understudied. That is sort of the combination of is a mindfulness program or a meditation helpful above and beyond exercise, or more so than exercise? I'm not aware of studies that have sort of examined them separately or together. I mentioned in the chat that in our studies, we really focus on mindful eating. I even tell my boys who are in high school, and like if they're sitting to eat and they've got their iPhone, it drives me crazy because they're not present. And it's the same thing just when we're exercising. Like some people like to exercise with music and others, and whatever works is great. But it is so about being mindful. We're just so busy these days that if we can be a little bit more present, that probably is really important. But it's not really been studied in detail.
So it's a great question, a good area to be focusing on. If these calls for applications come through, that would be interesting to look at. And Bernie, I was so glad that you said something about, why don't we have these we have guidelines and recommendations for this. The barriers to this seem enormous for individuals of trying to figure out what they should be doing. Obviously, it's in the backyard of primary care. We don't necessarily expect our oncologists or the cancer team to be talking about this, even though it's important. How do we push the ball forward in that arena?
As a cancer patient myself, when I was going through treatment, the providers focus only on treatment. and what's going on, side effects, etc. But you know, after that, there are so many opportunities when you go in for your follow-up visits, where you know they're doing their surveillance, but that's a great opportunity to talk about diet, to talk about concerns that patients have, especially when you have weight gain and those kinds of things. So, and I think for many providers, they don't see that as their role. But if you think of it, smoking, you know, is now considered to be a vital sign, and that providers do talk about. It's also reimbursed. However, there's a push, and exercise is medicine tries to is aiming at that, trying to make exercise as another vital sign so that it can be incorporated in routine healthcare when you go in. Very, you know, just like they ask you, are you smoking, etc. They should be asking us, what are you doing for physical activity? Are you doing anything? And also talking a little bit more about it to encourage the patients. Even if the patient doesn't listen the first time or doesn't do anything, the more you hear your provider saying, I think it's important for you to become active, you're experiencing these symptoms, physical activity might help. Every single time you hear that, you're going to become more and more motivated. I think part of it is providers just feel like they're not effective, and therefore they don't want to invest time. The other is time is precious to them because they have so few minutes to talk to us. So it's a lot of different problems that interfere with even with the most well-meaning provider. But I think the reimbursement issue could really be a game changer.
I think it definitely could. And I love the idea too of some physicians have taken the approach of actually having a prescription pad where they write on it, you know, a number of hours of physical activity and hand it to patients as an endorsement that this is something they need. Melinda, you have a comment.
Yeah, I have a question, and I'd love for your organization and other organizations that individuals on today's call could find out. We often are struck with the question of timing, when to intervene or when to offer exercise and other lifestyle programs. And many will say, oh, they're overwhelmed at diagnosis and let's wait till they're done with treatment. And that's why most studies have been done sort of post-treatment. But then when patients learn of the benefits, say, of exercise on outcomes, some are asking why they didn't hear about that earlier at diagnosis. And so that's why we're doing a current trial now that's during treatment. But it'd be really good to know from more of a community, you know, patients who aren't enrolled in trials as to what they think, because I think that will inform the oncology providers as to referring earlier rather than holding a conversation, but to have it sooner. And I think from a messaging perspective, telling people to maintain something or prevent something is easier than a treatment perspective.
Right.
And so I think it would be great to know more if you have a lot of surveys or opportunity to ask people in your community is what they think is the ideal time.
I think too, there are several studies right now and efforts, I think, in some of the cancer centers to offer exercise programs at pre-rehab, you know, for breast cancer as well as other types. So pre-cancer rehab is becoming more popular. It's has made a lot of inroads in Europe. And so we're moving the needle even further up and saying, yeah, why not right after diagnosis and thereafter? I think part of what I've heard among some patients is they do say at the end, I wish I had known about this while I was going through treatment. But sometimes when people are going through treatment because of some of the side effects, etc., and it makes it difficult for some of them to continue their exercise programs. And the fact that they have to come in 3 times a week or every day for radiation, they don't want to make one more trip for exercise, but they could do something very easily, perhaps at home.
Yeah, good points. And just a couple other comments in there. I mean, it is striking to me that the National Health Service in Great Britain has, for breast cancer, made this part of a recommendation. So newly diagnosed women, it is part of the treatment recommendation that goes to women saying you need to keep moving, you need to stay active right from the get-go, which makes me think, okay, here's a country that has embraced this data. I think the other point you bring up, and we have, of course, with us this evening, one of the representatives from Two Unstoppable, another great nonprofit organization that is addressing exactly this area for so many women facing illness. And I'll let Michelle make a couple of comments about that. And that is, you're making those linkages between cancer centers and what's in the community and where we're ready to provide this. And I think we haven't done a really good job of that yet and are hoping to do a better job. So if you want individuals to engage in this, where can you refer them? So sometimes I think clinicians don't bring it up because I don't know what to do about it. That was certainly true in smoking. 2 barriers there. They didn't think smoking cessation worked, wrong. And then it wasn't not my job, and I don't know where to send you. And of course, now we fund smoking centers in the big cancer centers. My fantasy for you all is that we fund exercise centers in the cancer centers and just say, this is, as you say, it's the 7th vital sign or wherever we're getting at the vital signs. But Michelle, do you want to say a couple of words about Two Unstoppable?
Thank you, Julia. I appreciate the opportunity. I think just in the context of what this conversation is, I will quickly say that the reason, so Two Unstoppable is a nonprofit formed to inspire and support women with a cancer diagnosis to get moving. That's exactly what we do. And the idea of what we decided to get together was kind of what you're talking about, is to make that connection between, even if a patient is lucky enough, and I was, to be honest, to have my oncologist in chemotherapy during that time tell me to keep moving as much as possible. And that's rare, and I know that. But even when an oncologist does tell the patient that, often the patient walks out and says, well, now what? I don't know what to do. And the oncologists are not trained in physical activity. They're not exercise professionals. And so that's not their area of expertise. And as you said, Julia, there are many other barriers. They don't have time. They don't have the expertise. They're nervous about telling the patient exactly something to do because they don't have that training. So we are there to make those, what we call fitness connections. We're trying to help patients to connect with whatever it is that's going to get them moving. So if it's an online resource, we'll connect them to that. If it's a class that we're offering, and we do offer some ad hoc classes as well as like longer term 10-week progressive group classes, we'll connect them to that. If it's having a buddy, and Dr. Pinto, you specifically mentioned a couple of times the importance of social support and having a fitness buddy and how important that can be. We actually connect women to a fitness buddy, another woman who has had a cancer diagnosis, wants to get moving, and needs support. So sometimes all it takes is, as both of you said, someone who's waiting for you. I think the mentor, Dr. Pinto, that you put on said, someone was waiting to walk with me, I can't let them down. Mm-hmm. So that can be very powerful. One of the Two Unstoppable members that's very active is on this Zoom tonight, Denise, and she's found several buddies through Two Unstoppable, and she does walk a lot. She's made fitness a priority, and we're very proud of her. She's done a great job. She's done all the things that you both recommended. And I think it's making a big difference. So we are there. We partner with the Smith Center actually on a lot of our programming. We provide exactly what you talked about. We provide virtual walk and talks once a month and virtual classes, and people can find us online at twounstoppable.org. But happy to answer any other questions.
We're definitely living in different times. And certainly one of the things that comes to mind, that's a phrase I think, that Bernie and Melinda have heard often, and that is, we now think about sitting as the new smoking. Mm-hmm. And in a lot of the studies now are not looking at how much you're moving, but how you're spending your leisure time, which is interesting. And of course, with the pandemic overlay, I think there's enormous concern that we've done a lot of backsliding during this period because people felt constricted in their ability to get out and do things. Their partner wasn't available, et cetera. So I think we're going to have a lot of back and fill to do moving forward. I wanted to make 2 other comments. We had the opportunity a while back to have Bryant Johnson come to Smith Center. So Bryant was Ruth Bader Ginsburg's trainer. Those of you who watched anything around the memorial service for Justice Ginsburg, he did a fabulous homage to her by dropping down in front of her casket and doing 3 push-ups, perfect form. But he did a sweet book with her. I don't know if you can see that, the RBG workout. So if you think you can't do something, think about RBG, multiple cancer survivor. There's something in here for everybody. And
Actually, Julia, after he passed away, he actually wrote something on social media that was kind of a metaphor for how she started doing push-ups and she couldn't do them at first, and he worked on it. At first he was, on her knees and he was helping her, and then eventually she was able to do push-ups and planks on her toes. And what he talked about was actually the slow, patient progress. It's continuing to be patient with your body. It's one of the mantras I have. Women who are trying to get moving, it never happens as fast as you want it to. It never happens as easily as you want it to, but be patient with your body. And he actually did a metaphor about how the persistence and patience that she put into learning how to do those famous push-ups and planks. And she did a similar thing with the law over time.
Yeah, remarkable. I mean, I wanted to say, will you please call the White House and offer to work out with Joe Biden? Anyway, but maybe Joe already has his own workout specialist here. I think the other thing I wanted this folks on this call to be aware of is that the American Institute of Cancer Research, or AICR, has just launched its new program. They have the American Plate, but they've just launched something called Healthy 10 Challenge. And it's a 10-week program. They have a special track for cancer survivors in it. So it's tailored for cancer survivors. And it's really diet, exercise, physical activity, and all the pieces to put together. And hopefully you can buddy up through that. I haven't tried it myself. I'm sure it's very well researched. But it's another kind of a link out there to which people can be referred if you need a motivator, if you need some guidance to do this, because I think sometimes the biggest barrier is just getting started. And I'm going to give Drs. Pinto and Irwin the last word here. And if anybody still has a question they need to ask, please put it in the chat box.
The advocacy, I think, is so important because, healthcare systems are in competition with each other, right? So if patients keep demanding certain services and they want to do better than their competitors, then they start offering more services. But the issue is, in terms of healthcare providers and advice of physical activity, it's not reimbursed. So the more patients push for things and ask, then the survivorship movement itself began because breast cancer survivors pushed and pushed. And that's where the advocacy becomes important, where each person speaks up. And even though you don't, if a group speaks up, eventually somebody's going to sit up and take notice. And when there's competition, that's where things do move. Right now, the oncology practice where I go get, for my follow-ups, has very little, if any, complementary therapies. And part of that is because there is no competition. Now that's going to change. So I'm hoping to see more services being offered. But you really need to ratchet up those services that help and impact patients' quality of life and recovery.
Thinking there are advocacy organizations like the National Coalition for Cancer Survivorship who are still out there advocating, or even the cancer support community who has a lobbying arm to it that has weight and heft, if you like, because it's a body of people and they know who to contact down on the Hill. They know who the movers and shakers are. If anything, this could be the time to really change the system, because COVID has laid bare places that we aren't doing good care. And I think we have the capacity when things start, opening again, to say we have to change this. We really have to change this. And never believe that a single voice can't make a difference. It can, Francie. So
thank you.
Whatever level that's at. I wish we had another half an hour here. I'm sure we could have a whole additional conversation, but unfortunately we're coming to the end of our time slot. And I just want to take this opportunity to really extend my heartfelt thanks to both Dr. Irwin and Dr. Pinto. They're longtime colleagues whose work I so admire. and respect. And they've been such champions in this area. And partly I love doing this work because of the passion of my colleagues. So I thank you for that. And for your, dare I say, moving talks. And I want, and in a nice interplay here, the next conversation we're going to have next month in this series is actually about managing stress. And of course, a lot of people turn to exercise as a great way to alleviate their stress. We'll also be talking about meditation at that session, because it's going to be on March 17th, 6 to 7:30 p.m. Eastern Time. Dr. Paul Jacobson, another colleague from the National Cancer Institute, will give that big overview. And Ms. Candida DeLuise, who's one of our wonderful facilitators at Smith Center, is going to run us through some meditations. She's had a lot of Buddhist training and is enormously talented at what she does. So if you need a calm down on the 17th, that's a great evening to come and do that. And we so thank you for joining us this evening and for your smart questions. And we hope that you will all keep moving out there. Best advice, somebody said, what's the one thing you would, tell a survivor? My mantra is always just keep moving. You just got to keep moving, whatever that's going to be, whatever that looks like for you. And as Michelle wisely responded back to one of the questions, what's the biggest barrier? Well, it's whatever stands in your way. Fix it and find it and address it. So again, thank you for coming and joining us this evening. I won't say you had to come out, staying in and joining us this evening. I hope the weather wherever you are is kind to you. If it's winter weather, stay warm and safe. And I look forward to being together again the next time.